Here are 12 things knee surgeons aren't counting on you to do about your knee arthritis. Number one is cancel your knee surgery. If you already booked with a knee surgeon to have your knee joint replaced, you're pretty much locked in. They're counting on you to go through with the procedure. It's almost terrible, to put it in nice terms, if you cancel, especially because you probably don't want to cancel on a surgeon. You made this appointment, you're worried about them getting all the arrangements and everything. But I can't tell you the number of people that have come into my office as a second or third opinion. They've already seen surgeons about it. And I look at them and I tell them, there's one thing that I want to make sure here. I'll have them lie down on their back. They're laying flat. This is their leg. And I pick up their leg and I bend their hip and knee. And it bends normally. This is limited right here. You should be able to bend a lot closer. Like your foot should be this close to your bottom. And they'll have good motion. And then I'll check their other knee and it'll be identical. It'll also have good motion. If you have good motion in both knees, then that means that the joint has the ability to move normally, despite there being a cartilage problem. Now, sure, when you bear weight, when you stand up and move around, you got issues, but what likely hasn't been addressed is the muscle imbalances that are over pressurizing your joint. And if you were to fix that and got the pressures to become normal in your joint, then you might be able to walk around just fine. And so I can't tell you the number of people that have come in. I mean, hundreds that we've helped feel better after they've been given a bone-on-bone diagnosis and have either been on the surgeon's list to have surgery done or have been considering it. And after just a month of treatment, we still have 2-3 months of treatment after that. But after the first month where they realize, oh, I can gain control over this, they end up canceling their appointment or deciding they don't need to go back to the surgeon for knee replacement. Number two is exercise consistently. In order to fix a knee problem like knee arthritis for the long term, you absolutely have to consistently exercise. And when surgeons are giving you the diagnosis of knee arthritis and then they're making the recommendation of a knee replacement, very often they're making judgments about the type of person that you are health-wise. They're looking at your weight, they're looking at your blood work, they're looking at other factors like that, and that's what they're trained to do. They're trained to figure out what is the best treatment for this person given their habits, given their tendencies. And if you're not in the best weight, if your blood work isn't the greatest, then they're assuming that you're probably not going to exercise. Even though they might be thinking, you could probably get away with not having surgery and dealing with your knee arthritis problem, managing it, but they might be thinking, this person's not going to do it. They're pre-diabetic, they got 30, 40 pounds to lose. Are they really going to exercise? Let's make the recommendation for a knee replacement because that's probably going to suit them better than if they were to go through the effort of having to exercise regularly. But you can prove them wrong. You can start exercising regularly. But you got to find the right exercises, of course. I can help you with that. That's something that I talk to people about online. Check out our videos here on YouTube. Check out our knee arthritis recovery program if you want a more structured way to do that. Number three is loosen stiff muscles. On the front of the thigh, the quad muscles are right on top of the kneecap. They all converge, they all come together and attach onto that kneecap. These muscles tend to be the most pressure producing muscle in the knee joint. So because they pull in this direction, it'll pull the kneecap up, and there's the tendon that attaches from the kneecap down here, a ligament technically. It pulls the shin bone up into the thigh bone and just adds tons of compression in here. And so you've got to massage that muscle loose. I recommend people get a massage gun and free that up, because if you can do that on a consistent basis, especially when you're flared up, you'll feel tremendously better, probably enough to not have to take pain medication. And it'll set you up to do exercises to fix the imbalance. Number four is stopping when it hurts. Oftentimes, healthcare professionals will give recommendations to people suffering from knee arthritis to go walking or to begin doing some exercises. Maybe a physical therapist might recommend exercises. And especially if you're being guided by a healthcare professional, you're likely to keep pushing through to do the exercise because you have that accountability, because they're supposed to know what they're talking about. But if your knee's hurting, that's not good. When it comes to knee arthritis, there is no such thing as no pain, no gain. Because they'll say something like that, like, come on, grit through it, toughen up, it's got to hurt before it feels better. You hear people saying stuff like that. But I strongly disagree because it's in the words. Osteoarthritis means bone joint swelling. It's Latin. That's where the medical term comes from. Bone joint swelling, osteoarthritis. How do you make things irritated? You add more pressure and irritation to it, more friction to it. And so if you go force yourself to walk, if you force yourself to do exercises and your knee is complaining about it, why would you force yourself through it more? It just doesn't make sense. And there are exercises that aren't supposed to be doing that to you, but that's just a sign that there's something else at play here. A muscle imbalance is likely what's been missed, what's not been diagnosed. And that needs to be addressed before you go walking. I tell people all the time, stop walking if you got told to go walking and your knee's hurting. Walking is hurting you right now. Even though the doctor told you to do it, is not good. Your body is telling you this. You first need to go figure out how to get your glutes working right, how to get your feet working right. And then once you can integrate that into your walking, only then can walking be helpful for you. So if it hurts, stop. But the surgeon is usually saying you need to be walking more, and they're not there visit to visit, day to day to tell you, oh, you're doing it wrong. This is actually hurting you, not helping you. So you need to listen to your body and stop. Number 5, the surgeons are not counting on you stopping taking pain medications. They went to school for it. They're MDs. MDs means you're a doctor of medicine. You have a medicine doctoral degree. So they kind of push medications. That's what they went to school for. That's what they're trained in. But medications don't fix knee arthritis. To this day, there is no medicinal cure for knee arthritis. So if you hurt and it's knee arthritis related, what do you think your surgeon wants you to do? Take medications. But if you do the right things, like use that massage gun, get the muscle to calm down, you're going to feel better and you're not going to feel like you need to take medications. We have patients in our knee arthritis program all the time telling us, I left taking medications, I stopped taking medications, I haven't had to deal with them in a long time. I take supplements now instead of medications because the pain's a lot lower and I feel like I need those better. We hear stories like this all the time. Number 6 is getting pain injections. Similar to taking medications, except pain medication might be injected in, or sometimes there's injections for other things like stem cells. Platelet-rich plasma or PRP injections is another one. Hyaluronic acid injections is another one, the rooster comb injections. All of these injections are not supposed to fix the problem. And with if anything, the hyaluronic acid gel ones are probably the ones that are pushed as thinking like it's going to fix the problem, but it doesn't. It doesn't fix those pressures that I was talking about. It might increase the joint space a little bit, which if you have bone-on-bone arthritis, that's something that could be beneficial for you. But your body will reabsorb that stuff and it won't stay there. And the doctor will tell you, you need to come back every so often, every 2 months or every month, sometimes less, maybe every 6 months. But it's not a cure. You need to make sure you get those pressures fixed around your knee joint so that you're not over-pressurizing the joint. Number 7, the surgeons are counting on you to stay on a cane once you start using it. I mean, I don't think they're going to tell you this. I think they all really hope that you get off of it. But what they tend to see is that once you start using a cane, you don't stop. And you might even progress to a walker. Right after the surgery, if you have a knee replacement, you're going to be on a walker. But you might never progress off of a cane after that. You might go down from a walker to a cane, but some people stay on the walker indefinitely after having a knee replacement. And the reason is because they didn't strengthen properly. If you gain strength the right way, you should be able to support your entire leg, especially the knee joint, and not feel like you need balance from an assisted device, from a cane or a walker or anything else like that. But if they make the recommendation of you to use a cane or a walker, they're worried about your balance. they don't want you to fall because that can lead to a break somewhere else, like up in the hip joint. They don't want you to mess up a surgery. If you're going to have a knee replacement done and you fall, that could mess up your surgery, and then you have to have a second surgery. So they're not counting on you to gain the strength necessary to leave the cane behind or leave the walker behind. Number 8, they're counting on you to avoid glute strengthening. What surgeon out there has directly told you to strengthen your glutes? Now, there's probably like 1 out of 100 of you out there that have maybe been told this. I'd argue it's even less, maybe closer to 1 out of 1,000. But you rarely ever hear surgeons tell you to strengthen glutes. Going to physical therapists, it's maybe more likely, but they're more likely to say just strengthen everything. Strengthen all the muscles around. But if you're not balanced in your muscle strength and you're putting too much pressure on one side of the joint or through the joint, then it doesn't make sense to strengthen everything because you're just going to keep the imbalance. It's just going to be stronger overall. Ideally, you want to put yourself in the right balance, which means some muscles you shouldn't strengthen and others you should, so that you can balance out the strength and the pressures around the joint. Strengthening the glutes is critical. You have to strengthen the glutes. I've yet to meet somebody with knee arthritis that didn't have weak glutes. Never, ever happened in my career. I've helped tons of people with knee arthritis, and we successfully do that because we spot weak glutes. Number 10 is getting stronger in your feet. You hardly ever hear surgeons talk about feet, probably less so than glutes. And physical therapists also neglect the feet a lot. Sometimes they will. You're lucky if you have a therapist that does. But the foot muscles, especially the muscles that support the arch, if you have a flat arch, are super important because if you have a dropped arch, that means your ankle's going to cave in, this whole shin bone's going to cave in, and it's going to change the position and the function of your knee. It's going to increase the pressures. It's going to make you tend to use your quads more, which feeds into the imbalance. So you need to get the glutes stronger up here to get those quads to relax, but you also have to get the toes stronger to get the arch supported so that you set up everything else from below. It's not just about the glutes, although it's the main thing. It probably solves 60, 70, 80% of people's problems. But if you get the foot stronger, you get that other 20% that you were missing. Number 11 is surgeons aren't expecting you to find an expert at helping you avoid surgery. To them, it doesn't exist. I'm a manual physical therapist, and that's my specialty. I get people that are on the surgeon's list to have surgery, and I can tell them if they're going to be successful or not. And there are people that I turn away and I tell them, your knee can't bend, and it's probably been like that for a while. Please go work with that surgeon. A replacement will do you good. But there's a lot of people that I tell them, your knee bends fine. It's just angry right now. And if you can get it to calm down, then we can see what we're working with. And chances are you're probably going to be able to be just fine. You're probably going to be able to get around just fine. And the limitations that you'll face in your current situation are going to be much less than the limitations you'll face if you have a knee replacement. So why get the replacement? Plus, you need to figure out how to manage your problem now, because if you get the knee replacement and you have this muscle imbalance, you're going to carry it into your life after the knee replacement and then have a not very happy time with a replaced knee joint now with all these limitations. So you're better off fixing the root problem. And worst case scenario, you fix the root problem, and if your knee is so far gone that you still have to have the joint replaced, at least you don't have to deal with that root problem after the joint replacement. It'll do you a ton of good to find a physical therapist, ideally a manual physical therapist in your area who knows what they're doing with helping people prevent surgery. And if you can't find somebody, go check out our knee arthritis recovery program. You'll find in the link in the description below here, the link around me on this video, and learn about that program because it might be right for you. Okay, I want to tell you about our knee arthritis recovery program. This program is specifically for people that have knee arthritis, whether you've been formally diagnosed, you've had an x-ray or an MRI and the doctor told you that you have knee arthritis, or you suspect you have it. And it doesn't matter how severe it is, if you've had it just mild, grade 1, some doctors will tell you, or if it's more on the severe end. If you have tried exercises and advice and tips that I've given you through our videos here, then chances are you have benefited from it because this stuff works. chances are even better that you're going to get tremendous improvements if you join this program. And let me just tell you how it is real quick, how the program's set up. It's a membership program, and there's different tiers of this. On the first tier, it's group coaching, along with the whole curriculum of 40 plus, I think it's approaching 50 videos now showing you how to do it. So you can just go through the program, watch the videos, and have massive improvements, but you also get access to group coaching where I'm on the call with you, me and my coaches, and you get to ask us questions so that you don't get stuck through this program. And then you also have the option to get our higher tier, which is one-to-one coaching with our recovery coaches, but you still get the group coaching too, and of course you get the whole curriculum as part of that package. So go check out the link nearby here to learn more about the knee arthritis recovery program, and I hope to see you in the program on our coaching calls. Number 12 is resolve the root problem. They're not expecting to do this. Surgeons think that it's an age-related problem, knee osteoarthritis. They think that it's only going to get worse as you get older because that's what they see. And that's what the research talks about. They see patients at 65, for example, and they're telling them, hey, you have moderate arthritis. We could go ahead and do the replacement today. If you want to see how long you last, great. I give it 2 years at most. I'll see you in 2 years. And then that's in your head. And then you're starting to think about it. Every time you flare up, is my cartilage gone because he said it was bone on bone? There's no control on your part. It's just a matter of how much you can tolerate. And you're just thinking, I can't walk too much. I can't take that trip. I can't go sightseeing. I can't go hiking. I can't run. I can't walk too. You have all these limitations in your head that you're living with because you don't know what to do. But if you can resolve the root problem, which is that muscle imbalance, and restore the pressures that are supposed to be normally going through your knee, then you can get back to walking and exercising and hiking, possibly even jogging, even though you were told you had a spot on your knee that was bone on bone. They're not expecting you to find the root problem because they don't think that way. The way that I want you to think, because it's successful with all my patients, is that it's a pressure over time problem. Too much pressure to the knee joint because of the muscle imbalance over too much time causes irritation, inflammation, eventually the cartilage to become injured and worn down. But if you take that pressure away, you can allow the cartilage to heal, you can allow the inflammation to go down, and over time, you can improve despite you aging. You're technically getting older day to day, but you can feel better. So it's not an age problem. It's a pressure over time problem.